Hey everyone, it's the Jason West program live at 5 o'clock. Always talking about health tips to make you healthy. And this week we're talking about viral infections, specifically the winter flu. And the most important thing that you're going to talk about is cataledins. I'm so excited to tell you what that is. It's a byproduct of vitamin D supplementation and why vitamin D is so important. So a shout out to the people that are always supporting us, the West Clinic team. Thank you so much for Robert Harmon, Arnold Bird, Tressa, everybody that's always here. I'm just so excited to share this information with you. And we have a live demonstration with my son Miles. He's graciously donated his body to science. We're going to talk about some of the most important ways to energetically affect chronic viral infections. It's so important because the two most neglected glands in medicine, which is the thymus and the spleen glands, certainly have a place in viral infections. So, and I'm going to show you what we can do with viral infections. I want to introduce you to Annette. This is a story that just happened. She came in earlier this summer with horrible chronic urinary tract infections that were just debilitating. And she came in, like so many people, skeptic, because she was like, you know, I want to believe that you can get better, but I've had so many antibiotic failures on the urinary tract infections. And I said, well, that's the problem. It's not a bug problem. It's a person problem. And I'm going to make the argument today as we're going through in flus and infections and viral infections, it's not a viral program. This is the narrative that we keep losing in all of the news and stuff. It's not a viral problem. People check, what are you talking about? There's this pandemic that's going around. It's a person problem. There's so many people that are getting better. There's so many people that are being exposed to the virus and either having mild or no symptoms. And the difference is the immune system. That's how you help people. You got to fix the body first, and then what happens is it'll take care of the bug. So everyone, I want you to introduce you to Annette, and here's her story. It's motivational, inspiring, and here's her story. Check it out. Hey everyone, it's Dr. West and Annette. We've just done her reevaluation and we looked at her blood and it looked so good, and we were just so excited to have her tell her story with other people out there that are struggling with their health. And Annette, when you first came in, how did you feel? What was going on?
Well, I've been having UTIs for years and years and years. And over the past few years, they've gotten worse and worse. And more antibiotics, and pretty soon I can't function anymore because it sucks out my energy completely. And I know that I've filled up with candida, which has to be stopped, but antibiotics don't stop it. So.
And one of your friends said, come up here, check it out. You come from a different state. Mm-hmm. You came up to the clinic, and what happened?
Well, you took an evaluation to begin with, and my blood didn't look very good. Mm-hmm. And in fact, it didn't look good at all. I was sticky with candida, and I had bacteria and virus, and I had all kinds of ugly stuff in there. Anyway, you put me on a regimen, and I was faithful with my diet.
Really good at, which, by the way, I have to tell, I'm really proud of you.
Oh, thanks.
Because it's hard to adhere to eating right, because there's so many good things that people out there put in the environment. Like there's this poison called sugar that people put in everything and makes everything taste good. And so I wanted to recognize, like, you really committed to a program. We did some infusions, and then what started to gradually happen?
Well, the infusions helped right away. And then we started doing insufflation with ozone, and that started to help. And I did go to a urologist too, who put me on another antibiotic. But when I was finished with that, then the ozone really started to help.
Okay.
And it helped better and better. And then I came back in twice a week. And then by the end of that week, I felt so much different than I had before. I had energy, and my husband could really tell the difference in how I felt because I had energy and strength.
And Annette, this is what we happen when we just try and work on balancing the body. Mm-hmm. And then we looked at your blood today, and what happened?
Well, it looked wonderful. Looked good.
It did. It looked completely healthy.
Yes.
And I was so happy for her.
Well, I'm happy.
And now the plan is we just want to make it sure that we put good stuff in the system. We can transition to kind of out of the office and to just keep your energy up and everything. And it's just a wonderful all-around story of someone really taking ownership of her health. And she's like, I'm going to follow this. I'm going to be consistent with it. And now I think, what are we, 8 or 10 weeks into it?
Or 10 weeks into.
10 weeks into
Today.
it. And she looks great. Her blood looks great. Her husband's noticing a difference. The main concern isn't there anymore. It's just, Annette, it's awesome.
It's really nice, yeah. And my husband feels like he can come and hug me again, because I won't just go, oh, I don't feel good.
Okay, so I didn't know that part of it. What a neat thing.
Yeah.
Annette, the reason why I asked you to do a video for us was I wanted people to see, if they're struggling with health, that there's some hope.
There's definitely hope.
And it's okay if I share this on social media?
Sure.
Okay, so Dr. West and Annette, a chronic infection process, not feeling very good, committed to a lifestyle change, used the best of alternative medicine, used some medical interventions, and now we have a really healthy specimen. And I said 2021 is going to be your year.
Yes, it is.
All right, so Dr. West and Annette signing out. We'll see you guys on the next video. So you guys, it's the same. And the same meaning, if someone walks into the office and they say, I have an E. coli infection or a staph infection, you say, hey, let's try and help your immune system to be healthy. Let's give your body some building blocks. Let's get some electron infusion in there. And then what we should do is let's get the nervous system to reboot. And this picture right behind me here, this is actually a photograph of the biggest natural disaster that's happened in the history of mankind. This is the 1918 flu, and there's been a lot of talk about it, especially with the viral pandemic that's occurring, because we don't want something to occur like this, because this killed somewhere between 20 and 100 million people worldwide. It's the largest natural disaster in the history of man, and you look at how they're treating it. It's oxygen and it's vitamin D. There's some magic that happens when ultraviolet hits the skin and converts essential fatty acids in the skin to cholecalciferol, which is vitamin D, and that really helps the immune system. Remember, vitamin D is really not a hormone. Excuse me, it's really not a vitamin, it's a pro-hormone. And we want to talk about how that helps. And whoa, a little sensitive here. Okay, the influenza known as the flu, man, what a mess. I'm sorry. The influenza known as the flu is type A or B, appears most frequently in the winter and early in spring, and it attacks the respiratory system. Well, guess what? That's what we're in the middle of right now, is a respiratory infection. And during the flu seasons, the vitamin D levels in your blood are typically at their lowest point due to the lack of exposure to sunshine and the vitamin D levels. Now, it's not just the flu we're talking about. I want to show you this next testimonial of a lady that had an unknown viral infection. This is Connie. Check it out. Hey guys, this is Dr. J. Welcome to our blog, A Daily Dose of Vitamin H. Just really excited to share an amazing outcome. I asked Connie if she'd come in and be on the testimonial, because when we first saw her a couple weeks ago, my thought process was, please don't die in the office because you're that sick. I mean, she just was really, really not sick. And Connie, what did they tell you that you had?
They told me, well, one hospital said West Nile, one said fever of an unknown cause.
Okay, but we knew you were really sick. And
I was sick enough that they kicked me out of the hospital. They couldn't fix it, and they said, don't come back here.
Okay, so she came to the office, and we started treating her for a chronic viral infection. We saw some things that, and whether it was the West Nile virus or Epstein-Barr or cytomegalovirus virus, we treat those pretty much the same, which is to make the body healthy. So what treatments did we do?
What? I have no idea.
Okay, so
infusion of
yes.
vitamin C, I think.
Yes, we at the
And
first
minerals.
she was so sick that we hooked her up to the vitamin C infusions and really give really high doses of vitamin C. We've gone through a series of treatments. Today is number 11, right? And how are you feeling?
I am feeling 90% or maybe even 100% better. And when I came in, I was taking ibuprofen and some other thing. And after that first infusion, I never took another thing.
So it was a remarkable turnaround to take someone literally with one foot in the grave to really 100% better in a series of treatments. Would you recommend anybody else do the treatment?
Oh, I think it was wonderful. When I came in, I laid my head here.
Yep.
I didn't even know what you looked like.
So I have got a lot of information from Connie's daughter. We had a little bit of interaction, but again, right after the first infusion, we saw a huge turnaround.
Yeah.
And so now we're actually getting ready to put Connie on our health and wellness program to make sure that we never slide back, but we're pretty much done with the treatments. Is it okay to put on social media?
Absolutely.
All right, you guys, this is Dr. J and Connie with the Daily Dose of Vitamin H. Okay, so you heard Connie's story, we've heard Annette's story, and guess what? There's a whole bunch of stories just like that, because when you balance out the body and make it give the body the building blocks to be healthy, you can make such a difference in physiology. And everybody's asking me right now, hey, what should I take to be healthy? And of course my joke is, you should take a break from social media, and then you should take some advice about movement and exercise, because it flushes the lymphatic system. And remember what the lymph is. The lymph is basically all the fluid that's in your body that's not necessarily in your bloodstream, and there's some exceptions to that. But what happens is our white blood cells find and attack the bad guys. They pick them up and they take them to jail. And where's the jails? It's the lymph nodes. And this is so important. Movement helps to impact the lymphatic system. And then one of my favorite papers that's on our website is called 3 Years of Hydrochloric Acid Therapy. It was written by Dr. Guy, who went to Africa in the 1930s and was successful in making a huge impact on Burkitt's lymphoma, which is a cancer of the lymphatic system. And how did he do it? He did it with potassium salts and hydrochloric acid. It's not something is patentable, but it's so helpful for things that are in the immune system, like the lymphatic. When it gets clogged and stuff, you can use potassium salts and hydrochloric acid. Now, of course, you want to be careful, because potassium, if you get too much, it's bad for you. If you get too little, it's bad for you. It's kind of like blood sugar. It's like cholesterol. High cholesterol, not so good. Low cholesterol, not so good. Needs to be balanced. But one of the things we talk about is the flu, because it killed so many people. And why do we get it? Well, one of the reasons why it happens more in the wintertime is because we're spending more time indoors with forced air heat. It dries out the mucous membranes. This is why water is so important for health. It's totally underrated. So many times people come in the office, oh, I don't really like water. I grew up not drinking water. Or it's just boring. It's so important for health. It's one of my first things that I tell everybody. Make sure that you're getting enough water. And then when the flu virus in 1918, and we have a connection with that. And here's the connection. My great-grandfather started our office in 1916 and became really famous for taking care of the flu. The flu went from 1918 to 1920. And some of the protocols that I'm going to tell you about in this presentation are over 100 years old. Sambuca, elderberry, vitamin A, and then my favorite vitamin, vitamin C. So the symptoms of the flu going into flu season: fever consistently over 100, coughing, a runny nose or sore throat, joint aches, severe headaches, vomiting and diarrhea, lethargy or lack of ambition or lack of motivation, and the disappearance of an appetite. Now there's so many different things that can cause those, and one of the easiest differentials to do is to do a simple, inexpensive blood test called a CBC with auto differentiation, a complete blood cell count, and you want to look at your white blood cells. A normal range, healthy range is 6 to 8. If it's high, it means your body is responding to an acute infection. And then when the differentiation, there's 5 cells that make up the white blood cell count: the neutrophils, the lymphocytes, the monocytes, the eosinophils, and the basophils. And the way that you remember this easy is 60-30-8-3-0. Never let my engine blow. If those are in the right ratio, and what happens, your body's responding correctly. And then one of the biggest problems, the thief of health, so oftentimes is a chronic viral infection. And you can tell this on a blood test when the white blood cell count goes down or if it stays the same and your lymphocyte count, which is your viral fighters, goes up. And what's happening is those chronic viral infections, and you frequently see this in herpes simplex 1 and Epstein-Barr and cytomegalovirus and parvovirus, and probably the biggest culprit is Epstein-Barr, but chronic viral infections lead to neurobehavior, neurodegenerative, psychiatric, autoimmune, and fatiguing illness. It's in a paper, the British Journal Medical Practitioner said that chronic immune system deficiency is the biggest culprit in autoimmune disorders. And then the other thing is the overconsumption of mucus-producing foods, like certain types of dairy, especially fake cheeses. So fake cheeses are the pseudoplastic cheeses, but also some unhealthy an overconsumption of dairy products. And then the biggest culprit of all, the biggest problem in healthcare, especially in the United States, is this addictive substance called sugar. And if you limit sugar, it's so healthy for your immune system, because what happens if you get high sugar intake, it decreases your immune system index. So let's talk about that for a second, because it's so important in flu season. Because what happens is you have these cells that are circulating in the body, the lymphocytes and the macrophages and the monocytes, and they come up to a bad guy. And here's the infection, and that cell hits it, and what happens is it engulfs it or encircles it. We call that phagocytosis. I was taught that the normal phagocytic index for a white blood cell, it can ingest 16 particles or 16 bad guys before it turns into a pus cell and dies. And what happens about an hour after 2 tablespoons of sugar, which is, for people that want to know, that's about the average consumption in a bagel or in a soda pop, it lowers that index from 16 bad guys to 4. And so what happens is your immune system goes down 4 times. Your body has to work a lot harder. This is why it's so important to limit sugar intake when you're sick. And if you're worried about your immune system going into Thanksgiving time, what you should do is really be careful with man-made sugar, white sugar, high fructose corn syrup. I tell people I'm really not concerned with natural sugars like what's in fruit or honey. I think is metabolized completely different. But let's talk about natural treatments for the flu. And then I'm really excited because one of my sons is here. So there's 5 of them, 20% of them volunteered for their body to be donated to science so that we can help people. So Miles is over here getting prepped, and we are going to, we turned the music up really loud. We gave him a stick to bite on so that he can't scream. We're going to show you how we can really help the flu. And of course I'm joking because he's over there. We're a little bit worried about this. Don't worry, it doesn't hurt me at all. There's nothing to worry about. May hurt Miles, but it'll be good for him. Now, what can you do if you have the flu? So here is the important things. Number 1, keep hydrated, but don't use sugar drinks. The best stuff ever is spring water. And then also, if you're going to if you want some fruit juice, just eat the fruit. There's so many phytonutrients and there's fiber within fruits. It's really tough on people when you take that out and just drink it. For example, you know how many oranges it takes to make a glass of orange juice? Typically 4 to 6. And how many people can sit down and eat 6 oranges? I would argue that you can't really do that because we have a shutoff valve. If you were to have multiple glasses of orange juice or apple juice or grapefruit juice, it's like getting 6 or 12 or 20 of the fruit. It's just too much. And then whole food vitamins and herbs and enzymes, which we're going to talk about, is really important. If you can't sleep, you can't heal. And stress levels. Every day in the office, I encourage people to have a stress outlet. And they'll say, what does that mean? And I'm like, you know what? Here's what all the things people are telling me. There's no right or wrong. It's just right for you. And that is going on a walk, prayer, journaling, meditation, playing a musical instrument, listening to music, reading a book that you enjoy, having conversations with your inner circle that are meaningful and impactful. But it's so important when you do that so that you have a stress outlet. Stress isn't a disease. It just makes every disease worse. So here's the one thing I really wanted to share with people, because I just read a study yesterday that said that people that are being impacted by the virus and the pandemic, it was my understanding that there haven't been any deaths occur of people that have vitamin D levels over 38 ng per ml or 38. Now when you do the blood tests, the range is 30 to 80, but ideal I think, is 80 to 100. If you can get vitamin D levels in people, here's what happens. Vitamin D stimulates your body to make a powerful antimicrobial substance called cathelicidin. Now, I had to practice that a couple times, but what it does is that is so important for the management and the treatment of viruses. A study over 19,000 Americans found that people with lower vitamin D levels have more colds and more flus. Now, here's the neat thing about vitamin D. It's so inexpensive to take. And I recommend vitamin D3. It's called cholecalciferol. There's a positive correlation between vitamin D levels and an increased risk of upper respiratory infections. And it's really important in the management of asthma and chronic obstructive pulmonary disease, which are both risk factors for not only the flu, but the pandemic. And part of the reason why this is so important, this is the vitamin D and peptides. Vitamin D creates over 200 antimicrobial peptides in your body that help the body to rev up and fight against bad guys. It's not just viruses. It's bacteria, it's parasites, it's amoebas, it's fungus, it's yeast, it's candida, it's colds. I mean, vitamin D, second favorite vitamin behind vitamin C. Now, I'm getting ready to show everybody what's on my, my tablet here because I wanted to go over some specific research. And so there's, let me just jump into this. Here we go. Caden, bring me up into my, my iPad here and so that I can show people what's here. Okay, one of my favorite websites, and a shout out to Sayer G. He runs a website called Green Med Info. This is one of my go-to sites for good information. And here's what it said. Cold and flu abstracts. Here it says, meta-analysis, 16 trials positive for echinacea in the treatment of the cold. Also, echinacea in the treatment and prevention of the common cold. Extra doses of vitamin C are really helpful. I actually hit the wrong button here. Let me just click over to this one. Okay, the other one that I talk about all the time is vitamin A. Now, most of the time we talk about vitamin A and it being in carrots and helpful for vision, but it also lubricates and basically coats the mucous membranes. It's really important for colds and flus. And remember, guess what the colds is caused by? It's caused by the coronavirus. It also is really important. It can mix with an essential fatty acid, monolaurin, and it's really effective against the cytomegalovirus. There's some really neat stuff about a chronic infection. And remember, a virus is a virus, whether it's the Epstein-Barr virus, whether it's the flu virus, whether it's the coronavirus, the herpes simplex 1 virus. The viral infections like Epstein-Barr can be associated with nerve problems, nerve degeneration. Intravenous vitamin C, which is one of the advanced therapies we talk about, is really important for Epstein-Barr levels. It's also really important in influenza. High-dose BD vitamins, suitable for the prevention of seasonal influenza. The number one thing that I would love to tell you about this information, if you're concerned about your immune system, if you get the flu every year, if you're worried about different viruses, please uptake or increase your uptake of vitamin D3. Here's one of the studies that says right here, vitamin D concentrations of 38 nanograms per milliliter or more in healthy adults is associated with a significant twofold reduction in the risk of causing acute viral respiratory tract infections. There's another one, immunomodulation on the effects of vitamin D in viral infections. Immunologic effects of vitamin D in human health and disease. Like, it's not just one abstract. Just in this one, there's 12, but there was hundreds when we get into the different. I'm just going to slide over. One more, two more. A combination of high-dose vitamin C and zinc. So here's the next thing I tell everybody about is there's so many minerals that are important for health. I would argue that minerals are more important than vitamins, and I just talked a whole bunch about vitamin D3 and vitamin C, but every vitamin has a mineral center. Many times if you have a healthy gut and you have probiotics in your system, you can synthesize certain vitamins, but you can't synthesize minerals, zinc being the most important one. And if you're taking vitamin C, you need a little bit of copper for that to work. You need some B6 for it to help the vitamin C to regenerate inside the body. There are so many things you can do at this time of the year. And I just want to go back to kind of the summary. In the flu season, vitamin D, vitamin C, vitamin A, I've been talking about this since March when the pandemic really started to affect the normal way of life in Americans. They were saying, what can we do? So many patients were calling them like, you know what, vitamin A, vitamin C, vitamin D, these are the dosages that I'm taking for myself. 10,000 units of vitamin A, 10,000 units of vitamin D3, 3 to 5,000 milligrams of vitamin C, and about 50 milligrams of zinc. And then I got just a tinge of copper. If you're eating colorful and alive foods, you're getting your copper, you're getting iron, you're getting magnesium. And what a neat thing to do to prepare now for family get-togethers at Thanksgiving and the flu-like symptoms. Man, if you're having those, if you're feeling lethargic, losing your appetite, chronic fever, ramp up your vitamin D, grab some vitamin A. Matter of fact, one researcher, Dr. Cannell, believed that the dose could be as high, like a short-term dose of vitamin D. A lot of times people will recommend up to 50,000 units. He said, you know what, maybe a consideration for 1,000 units per pound of body weight. So I'm 195 pounds. That would be 195,000 units. I've never gone that high, but it's interesting that he states that. For short term, I've gone up as high as 100,000 units and responded really well from the sniffles. Now, I like this picture of this wise man saying healthy vitamin D levels, it's not just for colds and flus. It prevents an astounding amount of common and chronic problems to maintain healthy levels, vitamin C, vitamin D, and then we always talk about how we can reset your nervous system. And this is why we're going to go over and work with Miles in just a second. He's right over here because we want to work on two neglected glands. One of them is the thymus gland, which is so important for cell-mediated immunity because there's two parts of your immune system. There's a part outside the cells called humoral immunity. That's where the antibodies and bacteria and stuff, and that's where antibiotics can make a big difference. That's where natural stimulants such as echinacea, golden seal, burdock root, garlic are really playing that pathways. But if you will have something inside the cell, which is where viruses live, you want to be thinking about the thymus gland, which is there's a way to stimulate that, and the spleen, which are really neglected in traditional medicine circles. So I'm not going to talk, I'm just going to go and we're just going to put the rest of this presentation aside. We're going to go in and we're going to show you what we're going to do with my son, Miles. He's graciously said that he is going to help us. So if I come right over here, Miles, can you say hi to everybody?
What's up, everybody?
Because so Miles, you're not sick right now, right?
Nope.
Yeah, so what we're doing, this is purely prevention. And I wanted to show everybody this is where the thymus gland is actually about right here. It's behind the substernal notch, and we just want to use a treatment called segmental therapy, where we're just going to work there, and then Miles, pull your shirt up. Okay, we also want to talk about the spleen, which is right in this area. There's a way to kind of jumpstart both of those. And so with that being said, I'm going to hand over the camera to my assistant, helper, and guess what? Here we go. So everyone, this is just one way to help to jumpstart the system. We had a lot of good feedback from Caden's scar, which we should probably show as a follow-up. But we just have a syringe of a special B vitamin that is really helpful for getting the nerves to open, close, and reset. And this is really good for the thymus gland. So we're just going to come down here. And Miles, let me have you move your hand. Okay, perfect. And we're just going to do some little blebs over where the thymus gland is. So I'm doing a very, very wide approach. And Miles is doing really good. He's gripping the table just a little bit. But that is such a neat segmental way to help people that have a need for getting their immune system to jumpstart. And then we're going to come down over here. We're just going to kind of work across where the spleen is at. And again, just a B vitamin that we are using to get the immune system to work. In acupuncture, the spleen is such an important organ, and we're just working on the skin over the spleen area, just doing a wide approach. That is covered in our neural therapy. We talk about this all the time. It's in our neural therapy videos. It's one of the most important things that we can do in the office. And so let me come back over here, and we're going to talk about the very end of the flu research. So thanks to Miles for sharing his body for science. He did a really good job, and we have to ask him really quick, Miles, was it painful?
Not at all.
Not at all. So I mean, you're always going to feel it when you come in and when you tap the skin. But man, does it have reset. So the nerves that come out of the spinal cord, what they do is they come down, they go through the organs and the muscles and the tissues, and they go to the skin. So then if you basically work on the skin layer, it helps to reset the organs to the spinal cord and the brain. It's a neural feedback loop. It's a treatment technique that we've been using in the office for years called neural therapy. That being said, I think this is a really good place to wrap some things up. I forgot to mention some advanced therapies. If you have the flu at this time of year, there are some things that are important to know about. Vitamin C, IV treatments, dilute hydrogen peroxide, hydrochloric acid therapy is a consideration. Things that are helpful for your immune system, vitamin C, zinc, vitamin A, golden seal, burdock, echinacea, garlic. I love elderberry. I love another Native American herb called Lomatia dissectum. There are a lot of things that you can use to stimulate your immune system. The most important things, manage stress, get enough sleep, get enough water. You guys, thank you so much for participating in our live cast. We do this every Thursday at 5 o'clock. We have some exciting news to share with you next week about ways to customize formulation supplements to cut down your load. We're also, the supplement load. We're also going to talk about some other medical success stories that are so fun to participate in. You're not your diagnosis. Every Thursday night, 5 o'clock, Dr. Jason West and the West Clinic team, and we'll see you guys next week.